Hi everybody, I'm putting my doctor hat on again. I'm Dr. J. Mawhinney. I want to talk a little bit about toxicities and poison plants and things like this. Now that it's springtime and everybody's planting things in their yards, kind of a good idea to know what's dangerous and what's not for your pets. Veterinarians are not horticulturists, and we have to look things up when people ask us about these plants, except for the real common toxicities like sago palm and the lily family, which are awful. But beyond that, we tend to go to ASPCA poison control. We either call them, or if it's about a plant and we know what it looks like, we might match it up. There's a website, aspca.org, O-R-G, and you can look up what plants are toxic and what plants aren't, and it's got a huge database. And it also has a section for the common toxicities too. And of course that ends up with go to your veterinarian immediately for immediate treatment. And then what happens when they come in, except for very, very routine things we see all the time, is we have to call poison control. Now this is a paid site. Don't be calling the human poison control line. They haven't a clue on the variations of pets and their toxicities. They're gonna give you their cookbook stuff for people, and you're not calling about a person. People get upset. There's a consulting website that I do a little bit of consulting on, and well, heck, even when they call into the emergency clinic, they get very, very upset that we don't prescribe things and diagnose things over the phone. Well, guess what? We can't. Ethically, it's illegal, and it's downright stupid, because we haven't established any relationship with you and your pet, and we can give it suggestions of what might need to be done and what tests have to be done. We give basic first aid and things like that, but that's about it. But as far as toxicities are concerned, whether it's a plant where you can actually look it up, or call one of the two poison control lines for animals. One is the ASPCA one, and it's 1-800-548-2423. That's 1-800-548-2423. And there's another excellent one that's out of the Midwest, and I heard the actual director of this talk at a veterinary conference a couple of years ago. She's excellent. And this one is 1-888-426-4435. That's 1-888-426-4435. Either one of these will work. They're excellent. There is a charge, but these are toxicologists. They are veterinary toxicologists, and they have the full database of all the human medications and what their toxic dose levels are, what they do, and how to decontaminate the animal and treat and save its life. And if you call ahead, it's a little cheaper than when the emergency clinic or regular veterinary hospital calls in, because we have to charge for our time, obviously. But either way, if you do call ahead, you'll get a case number, and then we as veterinarians can call there and we can get the ideal treatment regimen, how long we have to treat. Many of these things are for 2 or 3 days, believe it or not. Some are 8 to 10 hours. It just depends on what the drug is or what the toxin is. Please realize that we as veterinarians we're thinking of your pet. We're here to save your pet, not save you money. Really, it's so important. Don't ask for things outside of an exam other than, what should I do? Okay? We're not trying to hurt you. We're trying to help you. Love your pet, because they love in return and ask for nothing more than a good pat on the head and some food. Goodbye now.